dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and today we're going to be talking about common eye conditions with Dr. Parikh. Welcome.
Thank you.
So, cataracts. What causes cataracts?
Yeah, cataracts are what a cataract is. We all have a lens inside of our eye, and when we're born, that lens is this crystal clear, very flexible, almost like a ball of jelly. Lets light pass through it perfectly straight to a point focus because of the way the proteins are arranged in that lens. As we get older, the proteins within the lens start to stiffen, start to pack in, and also cross-link a little bit, which results in some loss of flexibility of the lens, which is why a lot of folks start to need reading glasses, for instance, when around the age of 45 or so. But even beyond that age, sometimes the lens can become cloudy as those proteins cross-link more and as the arrangement of those proteins change. Simply because instead of the light passing right through all those proteins in a perfect arrangement, the light scatters inside of the lens. So that causes a lot of symptoms for patients. You know, it can cause common things we hear are glare when headlights are coming at them at nighttime. It can cause a gradual dimming of the vision because a lot of light is just simply blocked from getting in. And some people can even note doubling of the vision from a cataract. And cataracts are the kind of thing where, you know, if you're lucky to live long enough, you're likely going to get cataracts.
And what's the treatment for it?
Cataracts are treated with surgery. So the lens inside of our eye, once it becomes cloudy, we call it a cataract. And once a patient feels that, you know, they're impacted in some way, I can't drive safely at night anymore, I can't do things I love doing or need to do because of work, that's when we would typically consider doing surgery on that patient. And the surgery is a day surgery, almost exclusively at this point.
So it's an outpatient surgery?
Outpatient surgery.
And what can someone expect regarding that type of surgery?
Yes, we have gone through a revolution for cataract surgery in the past 20, 30 years. You know, the mentors who trained me when they did cataract surgery back in the early stages of their career, folks unfortunately needed to spend days in the hospital, sandbags, pressure packs over the eye. But fortunately now, like I said, it's a day surgery, oftentimes with no pain involved, and oftentimes patients go home that day. They do receive light anesthesia. So, you know, an IV is placed. It's done either in a hospital setting or at an outpatient surgical center. And they go home that day after their driver takes them home. But oftentimes, even the very next day, they're seeing remarkably better compared to just simply 24 hours previously.
My goodness. And do cataracts ever grow back?
Fortunately, no. So once that lens is out, you know, the way we do is we unroof the top of the cataract. The cataract itself is chopped up into many small pieces and then removed, oftentimes with an ultrasound, sometimes with the assistance of a laser, and a lens implant goes in to the natural scaffold and support system that the old cataract used to sit in. The cataract does not grow back. Occasionally, in roughly 1 in 5 people over the course of their lifetime, they can develop a little bit of scar tissue of that structure which holds the lens implant in place. If that's the case, though, patients might notice that, hey, doctor, my vision was really, really good after the cataract surgery, but gradually I feel like it's getting a little worse. If they're complaining of that and there's some clouding of that lens capsule, we perform a laser procedure. It's an in-office procedure, does not require a trip to the operating room, and that laser procedure will remove that scar tissue that's, you know, obstructing the vision. Once that scar tissue is removed, that also does not come back, and patients are free and clear. And only roughly 1 in 5 patients need that painless procedure called a YAG capsulotomy. YAG is the type of laser that is used.
Okay. And then diabetic retinopathy, that's another condition, correct?
It sure is, yes. So diabetic retinopathy, unfortunately, is very, very common. Almost 10% of our population in the United States suffers from diabetes, and about half of those folks suffer from diabetic retinopathy in one way or another.
What is it?
What it is, so diabetic retinopathy is the same diabetic changes that happen head to toe, but when they specifically affect the retina. The retina is the inside lining of the eye, and it's almost, you can equate it to the film of the camera, essentially. It tells the brain what the eye is seeing. The retina has a lot of small, very fragile blood vessels that are present, and diabetes in many ways is a disorder of blood vessels due to high sugars. Well, you can see with diabetic retinopathy, what the patient experienced firsthand, oftentimes initially, is either the blurry vision right in the center from the small amount of bleeding that might occur from those fragile blood vessels, or perhaps even some swelling of the retina from fluid leaking out of the blood vessels. But occasionally, if the blood sugars are running very high and the diabetic retinopathy is not well controlled, folks can even develop more symptoms such as bleeding of new blood vessels that are forming inside the eye, which can cause many floaters in the vision. And in addition to that, they can even, unfortunately, suffer events where so many blood vessels grow that they pull on the retina and cause essentially a retinal detachment. Now, when you have someone with diabetes and they have a lot of changes to their eye, they can develop new blood vessels. And initially, folks might think, oh, growing new blood vessels, that might be a good thing. But unfortunately, the new blood vessels that are grown with diabetic retinopathy and other conditions of the eyes, those blood vessels are not structurally very strong. Oftentimes, blood leaks out of them, they bleed easily, and they cause a lot more harm and no good, really, unfortunately.
And with this whole process, your treatment of those symptoms would be?
Yeah, so it works in two ways. One thing that can be done is a laser treatment, because the root issue with diabetic retinopathy is that parts of the retina are really starved for oxygen, actually. But by using a laser, you can reduce the amount of tissue which needs a strong oxygen supply. And in some cases, rather than laser, what makes more sense is to introduce a medication into the eye that slows down either swelling or leakage of fluid from those blood vessels, or even stops the growth of new blood vessels. That is done in the office, a procedure that's done in the office that typically is not very painful, but most folks don't want medications in their eyes. So always, the number one way to treat things like this is with prevention, keeping very good blood sugar levels if you have diabetes, also having very, very good blood pressure levels, which is almost just as important as having good blood sugar levels in patients with diabetic retinopathy.
They're again taking the best care possible of your whole body.
Of course, absolutely.
And so the next thing that is a major eye condition, I believe, is the macular degeneration.
Macular degeneration, absolutely.
Can you explain what that is?
Yes, so the macula is a portion of the eye which is within the retina. It's the very, very center of the retina. And the macula, and specifically the very center of the macula, the fovea, pound for pound has more of a rich blood supply and kind of metabolism and cellular processes going on than almost anywhere else in the body. As a result, we can develop a lot of oxidative damage to the macula. Age-related macular degeneration, a lot of folks think of it as essentially accelerated aging of the retina. So if we all live to be 200 years old, we would probably all have macular degeneration to some extent, because it's just simply aging of the eye. But in folks who have macular degeneration, that aging is occurring quicker. So sometimes in their 6th, 7th, or 8th decade of life, they're noticing that the very center of the vision that's so metabolically active is generating a lot of essentially waste products which aren't being removed adequately.
Now, what do you mean by waste products?
Yeah, so whenever our cells are doing whatever processes they do, sensing light, moving proteins around, some oxidative damage and stress occurs. As that builds up, it can damage the cells, and the most common damage to the cells done in macular degeneration is to the photoreceptors of the eye. The photoreceptors sense light. They tell the brain, again, what the eye is seeing, and then they transmit that signal through the optic nerve, which is a cable that connects the eye to the brain. And when you have death of the photoreceptors, unfortunately, the very, very center of the vision can go missing. So folks might have relatively preserved peripheral vision, but they say there's like a spot right in the center of my vision that I can't see, unfortunately. And with macular degeneration, that can progress over time.
And the treatment for it?
There are ways to help improve macular degeneration and even treat macular degeneration, but there are two kinds of macular degeneration which are treated differently. The dry variety is the kind where you have atrophy and death of photoreceptors, but there are no extra blood vessels forming that are bleeding or leaking any fluid. So with folks who have the dry variety of macular degeneration, the focus is really on minimizing risk factors and helping prevent the conversion to wet macular degeneration. So risk factors for macular degeneration that folks can control would be not smoking. Smoking almost doubles your risk of macular degeneration. Again, more oxidative stress and damage to the body. And on top of that, having a good, rich diet of leafy green vegetables, and taking a specific supplement that a big study found can reduce the conversion to the wet form of macular degeneration where blood vessels form.
And what supplement is that?
It's called the AREDS2 supplement, and it's kind of a cocktail of some pigment that is present in the retina and some essential vitamins and minerals. That's for the dry variety of macular degeneration. For the wet variety, if folks unfortunately have blood vessels forming that are causing bleeding or swelling of the retina, again, similar to diabetic disease, and medications can be introduced into the eye to cause shrinkage of those blood vessels. And fortunately, that treatment is available now, even roughly 15 years ago. Don't quote me on the exact number of years, but that treatment was not available for us. And we have much better ways and methods to control wet macular degeneration now than we did previously, and we'll continue to have improvements as the year goes on.
Are there any vitamins in general that would help people in their entire bodies or supplements that can help the eyes?
Yes, so one of the most common ones that we often hear about is fish oil. And there recently actually was just a study that looked at fish oil and omega-3 fatty acids and how that can help with the surface of the eye, especially with conditions like dry eye disease. What they found was whether folks took a supplement that was very high in omega-3 fatty acids or what they called their placebo, although their placebo was an olive oil pill, whether they took the fish oil pill or the olive oil pill, folks had an improvement in their perception of how bad their dry eye was and also the signs that the doctor would see on the surface of the eye. So, the fish oil or olive oil, the conclusion of that study shows that it could be of potential benefit for the health of the surface of the eye for dry eye. Other things, the AREDS2 supplements, like I mentioned, for folks with macular degeneration can be very, very helpful. But I really think the most important thing that you could do from a dietary standpoint is, again, just having a good, well-balanced diet. We know that cultures that have a good quantity of fish, Mediterranean diet as well, folks where you're making healthy eating choices, I think can really, really help with the health of the eyes because you're reducing your risk of diabetes, high blood pressure, and all those things affect the eyes. And I'm not so sure 100% if it's anything specific about fish or the Mediterranean diet that's helpful, but every time you have one of those meals, you're not eating a cheeseburger, you're not eating something that's potentially harmful for your body, and I think that's very powerful.
Very good. Have we missed any other common condition?
Well, I would say glaucoma is another one that we often are screening for, and we're also often treating for patients.
And what is glaucoma?
Glaucoma is a disorder of the optic nerve. So the optic nerve, it's a cable that connects the eye to the brain and tells the brain what the eye is seeing. And with glaucoma, kind of the opposite of macular degeneration, you actually have loss of your peripheral vision with glaucoma, but it happens so slowly that no one would be able to perceive it on their own. So it's up to doctors to do what's called screening for glaucoma if someone has any risk factors for it. Just how we do screening with pap smears, colonoscopies, mammograms. Same thing with with the eyes. If someone has a risk factor for glaucoma, such as their eye pressure being high, maybe a family history of glaucoma, maybe the appearance of the optic nerve, the way it looks like someone who might develop glaucoma, then those are folks where we do some testing to ensure that they don't develop it. With the testing that we do, we're essentially making sure that the peripheral vision is remaining intact, and if it is not remaining intact or if there appears to be thinning of the optic nerve, then we are treating that adequately. For most people, treatment for glaucoma is with eye drops, simply reducing the eye pressure, because the best risk factor that you can modify for the development of glaucoma is reducing the eye pressure. However, there are other things that can be done regarding glaucoma. Some folks feel that migraine sufferers, folks who do a lot of yoga, and for instance, head inversions, that is associated with glaucoma as well. But the first step is really to adequately diagnose glaucoma. And the way we do that is two ways. We can rely on information that the patient tells us. So that would be doing a visual field test. I joke with patients as the most boring video game you've ever played, because you're basically just looking at an object right in the center, and every time you see a light, you simply hit a button. That will allow us to map out the peripheral vision. And every time we'll see changes on the peripheral vision that are very characteristic for glaucoma and showing some signs that the patient has already had some peripheral vision loss, even if they don't perceive it themselves. But in addition to that, we can measure certain things with the eye rather than relying on what the patient tells us. And what we most often measure is the thickness of the tissue surrounding the optic nerve, looking at its generalized health. Both of these tests and testing for glaucoma alone, one simple test, one simple data point alone, doesn't tell us too much often. However, if you follow that over time and you see if it's getting worse over time, then that can be a sign that, oh yeah, the eye pressure might be a little bit too high. You might be losing some vision from glaucoma, and we ought to start some eye drops potentially to reduce the eye pressure. In addition to eye drops, most people who have glaucoma are very well managed with eye drops alone, and they retain very strong vision throughout their life. Occasionally, however, we do resort to laser surgery. We do a procedure at the time of cataract surgery to reduce the pressure in the eye. Occasionally, we even do surgery for the glaucoma alone. So it's treated in a variety of ways, but it is very treatable. But like a lot of things, early detection is key, because with glaucoma, any vision loss that you have lost, you unfortunately can't get it back. So you really want to be sure that we're getting into the eye doctor, we're checking an eye pressure, we're making sure that there's no early signs of glaucoma, which could be treated adequately and early.
People have asked, what causes blood vessels in the eyes to burst out of, all of a sudden somebody has a red eye?
Yes.
What causes that to happen?
So the blood vessels on the surface of the eye are very, very fragile. And actually the tissue that is on kind of lining the white part of the eye, called the conjunctiva, is also extremely fragile. Sometimes simply blinking, simply moving that conjunctiva can rupture a very small, fragile blood vessel. Occasionally, it's the same small, fragile blood vessel that keeps bursting over and over, and it can be due to some extra folds in the conjunctiva called conjunctival chalasis. But there are other things that can cause that little patch of redness on the surface of the eye as well. Lots of folks are taking blood thinners, if they have atrial fibrillation or an artificial valve or another reason that they need to be on a blood thinner. Also, lots of times if folks are lifting something really heavy, generating a lot of pressure in their body for one reason or another, that can even cause those little blood vessels to burst. It's one of those things that looks far more dramatic than it actually is. We don't ask patients to stop their blood thinners if they have one little burst blood vessel on the surface of the eye, but it looks incredibly dramatic. If it happened around Halloween time,
right,
then that would be great because it doesn't affect the health of the eyes, but it looks concerning.
It does. How about conjunctivitis?
Yes.
Is that very common?
Conjunctivitis is quite common, it is.
What causes that?
Most conjunctivitis is caused by a virus. So the same types of viruses that causes a typical upper respiratory infection.
And it's highly
coughing,
contagious.
Sneezing, congestion, yes. The strains of that virus can be very, very contagious, spread through respiratory droplets, even our tears. Every year we go through this season of pink eye, and it is extremely contagious.
And what do people need to do to not get it?
Yeah, so with viral conjunctivitis, it's tricky. Like a lot of viruses, there's not a magic bullet that will just make it go away. And even antibiotic eye drops don't really have a role with viral conjunctivitis. Occasionally, sometimes the eye can be so inflamed that we do use a mild steroid on the surface of the eye to prevent scar tissue formation on the inside of the eyelids, to prevent inflammatory debris developing within the cornea. But most often what we recommend are cool compresses for comfort, washing your hands really well, taking the pillowcases off of your pillows, tossing them in the wash, having your own dedicated hand towel in the bathroom, and giving it some time, unfortunately.
And
because
consciously not bringing the hands to the eyes.
that's exactly
right.
right. And once you have those itchy eyes, it's really hard not to do. And
It is.
we've all had bouts of conjunctivitis here and there. I think it's also important to know, though, that not everything is conjunctivitis. Not every irritation of the eye is conjunctivitis. So, for instance, if the eyes are really, really red and weepy and tearing, but they're very painful to the touch, that could be a sign of something else. That could be something like an episcleritis or a scleritis, which is not a virus. It's actually almost like a localized autoimmune disease. That could be a sign of something that's not conjunctivitis. And also, sometimes folks get styes, little blocked oil glands, which cause a little bump. And sometimes the whole lid itself can get red and tender and painful. And that is not conjunctivitis either, but sometimes that's an infection, actually, of the skin around the eye requiring oral antibiotics. It's very tough, even for me to tell without the microscope and the tools that I have in the office. So oftentimes the best course of action, if folks are noticing new symptoms with their eye, which are not quite right, is to go and see an ophthalmologist or an optometrist who really has all the tools in their tool belt needed to adequately diagnose the eyes and what's
the
going on.
importance of protecting the eyes, let's say with sunglasses.
Yes.
What's the role of sunglasses in
Yes.
protection of eye health?
So sunglasses are very important. The less UV light that we're being exposed to, the better, to an extent. There's some role that for young children, it is very good to get them outside, get them some UV light exposure. There's some thought that, and very good data.
And how
showing
early
that.
should they be wearing them?
Well, I would actually, what I was actually getting at was that being outside a little bit for kids, even without sunglasses, is okay, because there's some data that shows that it prevents how strong of a glasses script they might need later in life. But you're absolutely right. Wearing sunglasses is a very, very good thing in general, especially in adulthood, because all that UV light, not only can it affect the eyes, it can result in cataract formation. It can result in changes on the surface of the eye, like little scar tissue forming and things like that. But even in addition to that, you have to remember we have all the skin around our eyes, and we unfortunately can see UV light associated skin cancers around the eyes in folks who have had a lot of sunlight exposure. Sunglasses are very, very helpful, and there's many ways that you can do it. If folks wear prescription glasses, they can have transition lenses essentially put in, so that when they go outside, the lenses naturally turn dark and block UV light. In addition to that, plain old sunglasses, even most commonly the sunglasses that you get, giveaways, freebies, and things like that, oftentimes they're UV blocking, but it's hard to know 100%. So getting a good, solid pair of sunglasses from a reputable brand, it can be an alternative for that.
And when people are involved in sports, other ways to protect their eyes would be?
Yes, there absolutely are. So, I enjoy basketball quite a bit. I really loved it growing up, and there are a few very, very famous basketball players who wore rec specs or recreational spectacles or goggles, and that is a great way to protect the eyes, of course. I play a lot of racket sports as well, and very critical, especially for things like squash and racquetball, swinging rackets close quarters to protect the eyes. The other thing that I do, I do a lot of woodworking, and with woodworking, it's very, very important to wear safety goggles. Safety glasses alone, unfortunately, are not adequate. What you really need is a good seal all the way around, because if you're cutting something below, it very easily can fly up and under.
That would be the same with stained glass.
Yes.
Because I do stained glass work, and cutting and the splintering of it. But,
exactly.
But you need those safety goggles that really connect versus just the glasses, you're saying.
You're absolutely right. A good contact between the glasses and the skin is really key. And as I'm sure you know, if there's a way for it to get up and under, it'll find its way. It's amazing how that works.
It's amazing.
Yeah.
Yeah, even in the beach. How about the beach, when people are on the beach? That's another thing to be aware of, because you don't want sand coming into your eyes, because that can impact them. What would you recommend?
Well, hopefully it's a bright sunny day and you've got your sunglasses on if you're on the beach, so that would be very, very helpful. But, part of it is you can't avoid everything, of course. Fortunately, sand is relatively benign, although it's an irritant of the eyes if some of it gets into your eyes. But I would probably recommend sunglasses. I don't think many people would follow my advice if I recommended they wear goggles, full time on the beach, unfortunately.
And in the winter, in the snowy, people think sometimes you don't need sunglasses, but you do.
Yes, you absolutely do. You can develop a really, really bad dry eye, especially when you're out skiing without goggles as you're whipping down the mountain. The really bright light being reflected off the snow can be very tough for the eyes as well. I am a big advocate for goggles, and sometimes you have to invest in a good pair that will not fog up on you, that will fit well over the helmet, of course, if you're skiing. But a good set of goggles are critical for winter sports.
And the protection of the eyes related to the sun, will that help a healthy eye and be able to protect people from the common eye conditions that we've spoken about?
It absolutely will. So UV light is a stimulant for oxidative damage. So a lot of the eye conditions that we spoke about are compounded by UV light. The more UV light protection that you have, the better.
Any other things that compound?
Well, smoking is one of the biggest ones.
Okay.
Taking good care of the body,
Okay.
not smoking, are probably the two best things that can be done regarding general health of the eyes.
As well as eating well.
Eating well.
Monitoring one's sugars, making sure one eats healthy and well in order to avoid any problems related to the diabetic area, correct?
That's exactly right. I'm sure it's a common theme on the show, but if you take good care of the body, you're going to take good care of the organs in the body, of course. And just living a happy, healthy life, I think, is really, really key for the eyes as well.
Is there a place that people could learn more about these common eye conditions?
Absolutely. So the American Academy of Ophthalmology has really, really good information out there, patient-centered, on a lot of the common eye conditions: cataracts, glaucoma, macular degeneration, diabetic retinopathy. So that's probably the first place I would go, the AAO website.
AAO.com.
www.aao.org.
.org. Excellent. This has been very, very helpful. We thank you very much for all that you do, and I want to encourage the listening and visual audience to watch the other program that we did related to your eye health also.
Thank you, Yvonne.
Until next time, thank you.